this policy conversation. Just a brief reminder that today's session is going to be recorded. Before we start with our conversation, we'd like to acknowledge the traditional owners of the country we're meeting on today. For me, that's the lands of the Muwinina people here in beautiful Nipaluna, Hobart. We would like to pay our respects to elders past and present, to acknowledge that this land was never ceded, and also to acknowledge the ongoing work of Palawa Pakana people across Tasmania in caring for country and community. Today's conversation is going to be looking at child and youth wellbeing, and I also want to acknowledge that we have such amazing examples from all across this country of Aboriginal people working with their communities and their families to keep each other safe and well. So we also extend our gratitude to those initiatives and those families, those people who've been doing that work for millennia. Today, we are really thrilled to be talking to Sharon Bessell in the aftermath of the 2024 budget. So before we kick off, we just wanted to have some brief, a bit of an overview of what the session's going to look like. And I think, Jill, just checking that you're able to share can everyone see the slides? Yes? Amazing. Just a little bit of general housekeeping. If you wouldn't mind, please keeping yourself on mute, at least until the end when we will have some time for questions. Questions are welcome at any time throughout the event. Feel free to pop a question in the chat. In the end as well, we would encourage people to use the raise hand function in Teams if you'd rather ask your question to Sharon or to Jill or I. We're going to have a little bit of a brief overview of what TASCOS's involvement to date has been in the Commission of Inquiry Reform Implementation Project, just because we've used some of that work in analysing our budget today. You'll hear from Sharon about her work. We'll provide you with a little bit of analysis about what we think of the 2024 state budget in terms of what we're looking for in the project that we're currently engaged in, and then we'll have some time for questions at the end. So I might invite Sharon to first start by sharing her slides so that she can give us a little bit of an overview of her work, her research. Sharon is a professor at the Crawford School of Public Policy at the Australian National University. She's the director of the Children's Policy Centre and the co-host of Policy Forum Pod. She's currently leading a research project called Mall for Children. This is a long-term project which uses participatory research with children, and it's in collaboration with place-based organisations and initiatives in Tasmania and Victoria. Her work is focused on three broad areas: social policy, social justice and the human rights of children, gendered and generational dimensions of poverty, and the experience of childhood. So thank you so much, Sharon.
Thank you so much, Meg. I'm assuming that everyone can both hear me and see the black screen in front of you with More for Children written on it. Meg, can you see that?
I can't see the screen, no.
You can't see the screen. I'll just let everyone know we have been practicing with making sure we could share the screen, but of course, when the moment of truth comes, it's telling me that it is sharing. So sorry, everyone, just bear with me for one moment while I see if we can, or if I can do this. Can you now see my screen? And you can see the slides?
Yes.
Right, fabulous. Sorry about that, everyone. So thank you so much for the opportunity to talk with you today about the budget, and also to share just a little bit about our research, which is on ending child poverty. And we've been working here in Tuita, Tasmania, but also on the mainland over the past 2 years on this research. And I think our findings and what children have told us is very relevant to the conversation that we're going to be having today. I'm here in Nipaluna, Hobart, on these beautiful and unceded lands of the Muwinina people. And during this research, we've worked on and built connections with people across Tuita, Tasmania. We've worked particularly on Padaway lands and also on Yorta Yorta lands in Victoria. And I pay my respects to elders past, present and emerging, and to all Aboriginal and Torres Strait Islander people who might be online today. And I just also wanted to very briefly acknowledge the fantastic team at the Children's Policy Centre who's been doing this work with me. So More for Children, the research project that we're undertaking, grew out of the conviction that in a very wealthy country, we can do much more to support children. Our aim is to better understand child poverty from a child's standpoint in order to act. We've built this understanding of child poverty by working closely and deeply within communities, with children and their families, and through building partnerships. We all know the headline figure that 1 in 6 children under the age of 15 live in income poverty in Australia. And it's generally higher here in Tasmania, and in some of the communities that we've been working with in Tasmania, the figure is more like 1 in 3 children living in income poverty. But what we don't know is what sits behind that number. We don't know what it means for children to grow up in poverty, and we certainly don't know what poverty is like from children's perspectives, how it impacts on their lives, their health, their learning, their play, how it shapes their dreams for the future. And we don't know how to respond to poverty in a way that's child-centred. And so what we're trying to do in this research is to provide some of those answers by working with and listening to children. So from our research, we've developed a child-centred definition of poverty. And there are very few definitions of poverty that focus on what children have said matters. So our definition is that poverty is the interplay between key non-material and material deprivations. It means that children don't have the material basics, their opportunities are limited, and vital relationships are not in place or are under pressure. Our research shows that poverty has 3 dimensions that are especially important to understanding children's lives. To end child poverty, children need to grow up in a context where there is money and material resources to meet their basic needs, but there also needs to be adequate and essential infrastructure available. Children need meaningful opportunities for connection, for learning, for play and participation, and they need quality child-friendly services. And importantly, we need to ensure that social and economic structures and systems foster strong and supportive relationships. This is really about transformative and systems change. And I think this research and other work that's going on is helping to show how those transformations can be done. So what I wanted to do now very briefly is share with you what each of these dimensions looks like for children when they're growing up in contexts of poverty. I'm not going to read out each of these quotes, but you can see them on the screen, and I'm happy to share the report that we've recently released. The children talk about not having the basics, not having enough food, warmth, or electricity. They talk about the cost of living, which they understand deeply because they experience its impacts daily. And children talk about the costs of essential items. Children talk about all of the things that they cannot do because of a lack of money, but also because of exclusion, discrimination, and disconnection. What you see on the screen in front of you is a message that was written to the Prime Minister by a young girl, which sums up the hope that is lost when children don't have opportunities. And a boy described his fears for the future, his worries that he won't have a job, that he won't be able to find a job that is anything other than low paying and insecure. He worries that he'll be homeless. He worries that his adult life will be as tough as his childhood. And children describe the ways in which poverty puts pressures on relationships, because poverty creates stress and tension, often as a result of the systems that we've put in place and the policy choices we've made. Parents also spoke about these pressures. Strong, caring, loving relationships can act as a buffer to protect children, but poverty eats away at those relationships. And we do have systems in place that often exacerbate the pressures. Now, not each of these dimensions in and of themselves necessarily indicate poverty, except perhaps the material dimension, which is closely associated with income poverty. But when those dimensions overlap, we see multidimensional poverty, and often very deep multidimensional poverty. I am going to read this quote, or at least the first part of it. This is from this quote is that, so when life is tough at home, it's anger, it's heartbroken, feels like pain is in the air, devastation is everywhere. And that's what multidimensional poverty feels like for a child. These eloquent and powerful words are not mine, but they're from 12-year-old Max. The More framework allows us to identify the causes of child poverty and to address them. And it's very important that we think about multidimensionality when we think about child poverty. So this framework provides us a way of identifying what is working and to build on what is working well, but also to change what is not. And importantly, it helps us to scaffold well-being for all children and their families. There are three key messages from our research. Firstly, that child poverty is multidimensional. It's about a lack of income, but more. For well-being for all children cannot be achieved unless child poverty is ended. And middle childhood tends to be missing from policies and services. And we're creating a policy cliff as children begin primary school. And there are three additional points or messages from the research that I just wanted to add today in the context of the discussion that we're about to have. We cannot resolve the challenges of the child justice system without addressing child poverty, nor can we address the challenges that we face around child protection and the child protection system unless we think and act very differently around child poverty. And we need transformational shifts rather than just patching, even though patching may be an urgent short-term measure. And so a couple of points that I just wanted to make in closing as we think about the budget and what it means. There are three big messages that I would suggest are important. Firstly, no single budget can fully address the challenges that we face. Budgets must be part of longer-term strategies. The second point is a big one. The economic system that we have, not just here in Tasmania, but globally, is not working. And it's not working for the most vulnerable. So in all else we do to try to alleviate immediate problems, we need transformational shifts. And the third message is that within the current economic system, which has serious problems, Tasmania's position is especially precarious and perilous, and that's worrying. And a few more focused messages around the budget. The language that we see in elements of the budget, particularly focusing on child and youth voice, decision-making and empowerment, are very welcome. And the gender analysis that's done around budgets in Tasmania is also welcome. And from that, we see that violence against women and low educational engagement and attainment, particularly amongst boys, are deeply worrying. But I would say that poverty is insufficiently addressed in the budget, and there is quite a bit of patching rather than focusing on the underlying structural issues. And I hope that we can talk about all of that more in a few minutes. So thank you so much for the opportunity to share our research and to give those first initial messages around the budget. And I'll leave you with this message from 10-year-old Mr. Hippo, who took part in our research, which is to show kids respect. And we can show children respect by ending child poverty. So thank you so much for letting me share some of those ideas. I will now, I hope, stop sharing my screen and hand back to Meg.
That's great. Thank you so much, Sharon. And also, a huge, acknowledgement and thank you to all of the children that you're working with. A lot of those messages are incredibly powerful. And in times like this, where I think a lot of us can really get mired in the facts and figures and detail of a 700-page document, I think it's really refreshing and useful for us to reflect on those messages, which are, really the underlying reason why all of us are here. So before we jump into how Jill and I have kind of undertaken the process of looking at the budget and what it might mean for the Commission of Inquiry implementation project, I just wanted to very quickly touch on the work that we're doing. For those of you who don't know, TASCOS is working alongside other community organisations on a project specifically looking at the implementation of recommendations from the Commission of Inquiry. So at the moment, our work has been a mix of different activities, but I suppose a key message that we're hoping to drive home, the Commission of Inquiry was looking at institutional child sexual abuse, but the research, what we hear as well from Tasmanian community organisations and families, and what the research clearly says is that that's only a tiny fraction of what is actually happening in communities. So our response and our involvement in this project is really to bring home the message of what communities and families and community organisations need. So government accountability is a part of what we're doing, but we're also using this project as an opportunity to address those underlying issues relating to child sexual abuse in Tasmania more broadly. So I might throw to Jill now to have a discussion about how we've used our work in the project to date to undergo this work this week with the budget.
Thanks, Meg. And if anyone has other questions or wants to get in touch about the project, I've put our email addresses in the chat. Can you see the slides now? Yay! Great. Okay, so the way that we've gone about analysing the budget is using some policy objectives or key principles that we have developed for the reform implementation project generally. So we developed them through reviewing existing research and literature, including the Commission of Inquiry's final report and the government response, and also considering TASCOS's values, which are integrity, compassion and influence, and thinking about the potential impact of reform on Tasmanians experiencing hardship and or disadvantage, and the needs, views and experiences of community organisations. So those key objectives that we think are really crucial for being able to address child sexual abuse in institutions as well as in communities is keeping children safe, requires a focus on the prevention of harm. So we would like to see actions that are not just about responding when harm has already occurred. The second principle is that keeping children safe requires strong, well-connected communities. We know that children do best when they have people around them who can keep them safe. And keeping children safe requires well-supported community organisations. We know that it's the community organisations that are doing the work to try and keep kids safe and identifying kids who are not safe and responding to them. And we also think that keeping children safe requires transparent and accountable institutions. We don't think that the government can address child sexual abuse without being more open about what's going on in those institutions and the actions that they're taking. So those are our principles that we use to think about this budget. So in that context, we were looking for targeted initiatives looking to address prevention and awareness raising. So really thinking about how do we stop kids being abused? Support for specialist organisations working with children. So that includes both children who are victim survivors, but also children engaging in harmful sexual behaviours, as well as specialist organisations working with some of the priority groups that were identified by the Commission of Inquiry. So Aboriginal families, children with disability, culturally and linguistically diverse families, for example. But also we think it's really important that generalist community organisations receive more funding because they're the ones supporting their families across Tasmania and often that first point of contact. Okay, and then we were also looking for funding of oversight or accountability bodies or for projects increasing public awareness and civic participation and measures to address poverty and disadvantage because as Sharon was saying, you can't really address these issues without addressing poverty. So that's what we were looking for in the budget. Back to Meg.
So we had quite a few big ticket announcements relating to the Commission of Inquiry, which I'm sure you all saw. And a few of those are on this slide that we have here. So by far, the largest expenditure would relate to the money that's been allocated for current and future claims against the state. So clearly that's really important. And also just to kind of take a moment again, I think to acknowledge the people who gave evidence at the Commission of Inquiry, those children, their families who shared their stories and the impact that that has had. And alongside or within some of these key big picture announcements, there have been some really welcome announcements focusing on things that we think really relate to how communities can be better supported. So funding announcements that relate to neighbourhood houses, for instance. So as local place-based early intervention organisations, we think neighbourhood houses are really well placed to work collaboratively with communities. I will say, however, that the announcements don't really represent additional funding. My understanding is that it wouldn't be sufficient. What has been provided or allocated by the government doesn't represent an amount that would allow those houses to increase or expand their programs. So that's something to be mindful of. We also welcome the announcements that relate to funding for therapeutic responses. So there were announcements that relate to responses for working with children. So the development of a whole of government approach to identifying, preventing and responding to harmful sexual behaviours. We're really hopeful. All that's been announced at the moment is that funding commitment, but we're hoping that this is going to be developed in collaboration with community organisations who have expertise working with criminalised children and their families. For adults, it was announced that there is going to be funding to establish preventative group and one-on-one counselling treatment programs, not just for people who are already within the criminal justice system, but those who identify themselves or others at being risk of offending. So again, we would really welcome the development of that type of early intervention prevention work. There's also been some funding which could be interpreted as initiatives which might address some of the current gaps in the service system for children. So mental health has been raised with Jill and I as a pretty consistent issue, the lack of adequate mental health support for children and young people in Tasmania. So funding was announced to build a 12-bed standalone child and adolescent mental health inpatient unit and day facility. So that's a positive announcement. We would just note that we would hope that this response is also going to be bolstered by funding allocated to community-based mental health initiatives alongside what is otherwise quite a tertiary response. And we would just kind of like to note as well some of the comments that were made last week by Connie de Gollis, the CEO of Mental Health Council of Tasmania, who said that while having modern and appropriate facilities are important in the delivery of top quality mental health care in our state, the significant increases in mental health concerns we're seeing aren't due to a lack of beds in our hospitals and acute mental health services. These increases are, however, directly related to underinvestment in prevention and early intervention. Similarly, there was funding announced to establish a comprehensive mental health response within out-of-home care or for children who are at risk of entering out-of-home care. This is a really welcome announcement, and we're really hoping, again, that that's a strategy or response that's going to be developed in collaboration with community organisations who are already working to support those children, as well as organisations like Create Foundation, who work directly with the children themselves. We also note that there were some funding announcements that relate to oversight mechanisms. So, for example, within the funding for the Ombudsman, there was specific funding allocated for the Tasmanian National Preventative Mechanism, which is welcome. We do note that it's quite limited funding. It's $300,000 per year, which, we understand that concerns have been raised about whether that's really sufficient to perform the work of the National Preventative Mechanism, which is quite comprehensive in its scope. But funding for oversight bodies is definitely something that we would support. However, we are concerned that a lot of the funding announcements are focusing on the tertiary end of responses, not enough investment in long-term preventative and early intervention measures. So a lot of money was announced relating to Ashley Youth Detention Centre, and that's understandable. So many concerns have been raised about the safety of children at Ashley. However, and there are some announcements which we support. So there's funding that was announced for clinical service practitioners to work with and case manage the children at Ashley with complex and intensive needs. So we strongly support the extra provision of therapeutic supports at Ashley, and we would really hope that those supports are going to be provided by organisations who can then continue to work with children in the community as they transition from institutional to community-based care. There's also been some funding allocated to establish clear processes and guidelines for assessment, case planning and case management of children, which again we would hope would be developed in collaboration with community organisations. Additional funding for physical and mental health care support, which is welcome. However, a number of the announcements relate more to statutory service system responses, so additional funding for liaison officers and critical case management. We're just concerned that this might not be investing in an institution itself rather than investing in the communities and community organisations that would support those children when their transition from care would be something that we're concerned about. Some of the announcements relating to out-of-home care and child safety are similarly, in our view, mainly targeted at the tertiary end responses. So we know that a number of community organisations have raised concerns about the lack of child safety workers, particularly in certain parts of the state, which is really concerning, and it's great that the government is allocating funding to this. However, we know that other community organisations have raised concerns about the difficulties in recruiting for community organisations and ensuring that community organisations also have the staffing and the capacity to work with children who are perhaps wanting to engage with those community organisations as an alternative to a more tertiary statutory response. And we also know that systemic change won't be achieved or maintained without additional funding for these community workers. And these are messages that we heard really clearly in community responses to the budget last week. So, for example, we have a quote here from Tanya Hunt, who is the CEO of the Youth Network of Tasmania. Everyone in our state will need to contribute to the fundamental cultural change required to keep children safe in our communities. We look forward to seeing the detail of how these funds will be spent and note the essential role the community service industry has in challenging and transforming cultural attitudes and beliefs that perpetuate harm. So that's our take on what we have so far, and also noting that there are quite a few elements about which we're hoping we will receive more detail as certain initiatives or policies unfold. But unless anyone has any questions to kick anything off with, we have a couple of questions to start with that we were wanting to pose to Sharon. And first off, I'd love to hear, Sharon, in terms of what your research would tell us about childhood in Tasmania and what Tasmanian children may need. From us as community organisations and from the government, what things are we getting right, and where do you think we should be investing our money, time, energy if we're wanting to improve the experience of childhood for Tasmanian children and their families? You're on mute, Sharon.
I just said many profound things. Sorry about that. Thanks, Megan, and thank you for that fantastic overview of the budget and what's welcome and where perhaps it falls a little short. So in terms of what our research tells us about childhood in Tasmania, I think the first thing that I would say is that one thing that is different in Tasmania is the sense of identity that children have, the sense of being Tasmanian, and sometimes being from a more localised place, but that sense of being Tasmanian is really powerful and it's really special to children. And I think that gives us an incredible starting point to be able to have conversations about how we build communities in a state that is as wonderful as children would want it to be. So I think that is something that's important and is something that's different. The other thing is that in terms of having a well-developed, well-thought-through wellbeing strategy for children and young people, Tasmania is ahead of most other states on that. So that, again, is a positive in terms of the foundations that we have to build on. But and I should preface this by saying that our research has been about child poverty. And so the children that we've been working with, most of them, the vast majority of them, have direct experience of poverty or have experienced either themselves or what they see around them. And so what we hear a lot about is the lack of infrastructure, Transport is a major issue, particularly for children in regional areas. And so that has really important implications in terms of the opportunities children have to be part of their communities. And it also puts pressure on families, because just going to get the groceries is a major problem if you don't have the money for the petrol for the car and there's no public transport. We hear a lot about housing insecurity from children, and we hear a lot from children who've experienced emergency housing about how terrible that experience is, because emergency housing is often not fit for children, not fit for humans. And we can talk more about that later if you'd like. And the other thing that we hear about is the power of relationships and what it means to children when they have strong and supportive relationships, not just in their families, but in their schools or in their communities. But so many children are quite isolated. And for some children, school and their bedroom are the two places that they spend most of their time. And so when children are isolated, they are more vulnerable. They don't have the web of support around them that we would want them to have to ensure that they are safe. And if they feel vulnerable or they feel afraid or they feel uncertain, that they have both trusted and trustworthy adults to talk to. So I think that relationship part and the isolation some children are experiencing is really important.
Thanks,
and I think
Sharon.
that's a really important part of that community strengthening, especially with everything that the research shows us about the impact of financial insecurity on individual stress and family stress. So that is something that's really important. If you're not able to feel connected because your family is really struggling, or your caregiver isn't able to engage with you in that way, it is just so much more difficult for children to form those connections, which is why that scaffolding that ideally is provided within community is so important.
And Meg, I'd add to that I think we see particular issues for children who are growing up in contexts of poverty. And I would just add to this, the one thing that we see again and again in our research is the love and care that children and parents have for each other, even in the most difficult circumstances. But we also see just how hard it is for parents to be able to provide what they want for their children when they're running on empty, when they're struggling with all with all that stress and pressure. So I think it's really important that we acknowledge that. But some of these issues around the sense of isolation and the sense of disconnection are particularly acute for children when families are really doing it tough. But I think we've seen in other research that this is increasingly an element of all children's lives, regardless of their family's financial situation. And so I think we need to do much more work, not just in Tasmania, but in right across the country, in creating communities that are genuinely inclusive of children. And that does mean resourcing community organisations and neighbourhood houses that are able to do that connecting work, but also making sure that those organisations are genuinely child inclusive or child centred themselves. And I think what we do see in our research is that real gap around middle childhood, and we're missing a real opportunity there to better support children from the very early years. And we do have good things in place for the early years. I think, if we look at the positives that Tasmania has, the Child and Family Learning Centres are fantastic. They're an amazing resource. But then once children start primary school, that support stops. And for families, once the last child starts primary school, then that's the end, not just of the support, but the networks and the sense of care that's been established. So one of the things that we really need to pay much more attention to as we think about that critical role that neighbourhood houses and CSOs play is how we continue on from the early years so that we don't get that cliff where policies and services just drop off at the start of school, because we assume that schools can do it all. But of course, schools can't do it all. Schools are not resourced to do it all. They don't have the capacity. And we need to ask ourselves whether we want a situation where every aspect of children's lives are channeled through one single institution. So if we genuinely want to keep children safe, we have to start building those communities from the ground up. And it's too late to start thinking about how we do that when children are 13, 14, 15.
It's also response driven. What we're talking about is a long-term kind of continuum of care, which could be structured across a lifespan. Instead of having it's understandable, we need to be able to respond to critical incidents, but we also need a system and communities that are robust enough to provide that support throughout the span of, either childhood or life in community, or something that's more kind of continuous and less determined by these very arbitrary measures that for some children aren't going to have much relevance.
Yeah, and by the time that the intervention happens, particularly around child and youth justice and detention, by the time that intervention happens, at the critical point, then the problems are already so deep. And what we need to be aiming to do, and Meg, I think the point that you made around the resources that are going to Ashley are really important, because we know that that's an institution that needs more to be able to do better for children. But ultimately, what we want to do is ensure that no child ends up in Ashley, or the children that are there are very small in number and incredibly well supported. But ultimately, our goal should be to be providing community-based interventions before the situation becomes so dire that children are facing or finding themselves in the criminal justice system at a very young age.
Thanks, Sharon. So, and thinking about that, the focus on prevention and those other priorities that we have for our project, how aligned do you think the budget is with that focus on prevention and keeping children safe in their communities and supported community organisations?
I think, and we often see this in budgets, and of course it's easy to sit on the outside and to criticise, and I recognise the incredibly difficult decisions that have to be made, particularly when the overall economic situation isn't strong. However, we are seeing a lot of attention placed on the tertiary end rather than investing in prevention. And I think if we look at the Tasmanian Child and Youth Wellbeing Strategy, it's a really powerful and strong piece of work. And the kind of the tagline to that has been, it takes a village, or more specifically, it takes a Tasmanian village. And that is really powerful. So we have that idea that's well established and that's embedded in policy around the importance of creating a Tasmanian village to ensure children's well-being. But then I think the resources are not necessarily flowing in that direction. The resources tend to be flowing towards the tertiary end. And of course, once we find ourselves in a situation of crisis, then that short-term tertiary response is what keeps us focused. But ultimately, what we really need to do is to start to look at prevention and to start to look at the way in which we can shift the systems and structures that are causing the problem in the first place. And I mean, our research is focusing on children's experiences of poverty. And so I tend to come back to that. And I'm not for a moment suggesting that growing up in poverty means that children are more likely to engage in criminal behaviour. That's not the case. But very often the children who find themselves in the youth justice system have experienced deep poverty and the trauma that comes with it. So part of all of that trauma that children carry is the trauma that poverty creates. And so we really need to be addressing those underlying issues as well as, and over time, instead of the very significant focus on tertiary responses. And I think the other thing that I would just say about the tertiary responses that we're seeing, and this is more to keep an eye on the detail than anything else, is that within both the preventative responses, but also in tertiary responses, what is really crucial for children if they're going to be able to move beyond the or to cope with the trauma that they've experienced, is to have strong and supportive and consistent relationships. And what we see in some of the tertiary responses is the lack of recognition of the importance of those relationships, and those relationships being ongoing and consistent. So we need to shift to prevention, but we also need to recognise that even in delivering those tertiary responses, we need to develop trusted and trustworthy and caring relationships for children. And that's something we do very badly in institutions. And it's something that we do particularly badly in the out-of-home care system. And some of the shifts that we've seen towards kind of team or call centre based responses, rather than children having their own ongoing worker, is really problematic, because that erodes children's trust and their ability to reach out for support, and understandably so.
Yeah, and I think what we're kind of talking about here ties in quite nicely with an example that, oh, wait, no, Jill wanted to jump in with an example. Sorry.
Oh, no, I think you're doing exactly the same thing. I just saw Charlie's question in the chat, and also our prior discussion about perhaps giving an example from your work of organisations that are actually doing this relational stuff really well. So where we're not getting the support perhaps from government to implement those longer term relationships that families can rely on. Are there examples in community where that's kind of being done anyway, where people are taking the initiative to do that?
Look, I think we do see some really powerful examples of that. And we've been working on the Northwest Coast with Burnie Works. So I just give a shout out to the work that they're doing. And a lot of the work that Burnie Works is doing is about not delivering the services themselves, but creating a broader context where relationships really matter, and where a lot of time is put into creating relationships between community organisations and service providers and the community that they're serving, and also building relationships amongst the community. One of the really exciting things that the Burnie Works has done over the last 12 years or so, work was led by Chandel Pyle, but now being led by Kira Coughlin, is fantastic work around a community knowledge collection approach. And so they're working with communities to understand what really matters to them. And one of the things that they found adults and particularly parents talking about was this problem of middle child, or not the problem of middle childhood, but the problem of the policy and services cliff when children reach middle childhood. And so Burnie Works has responded to what the community has said by working with members of the community to develop a community services hub, or sorry, a middle years hub, I should call it, to develop this middle years hub. And what was really exciting about that was exactly what children were telling us in the research. So I think we have examples where community organisations are working really closely with communities to identify what's needed and then to deliver on that. I do think one of the challenges for many community organisations is being child inclusive, and being inclusive not just of young people once they get into their adolescence and beyond, but being genuinely inclusive from children from the early years, and particularly through that middle childhood period. You know, we hear children saying to us they want to be part of their communities, they want to contribute, they want to volunteer. Children talking about wanting to support the elderly people in their communities, but they don't have that opportunity. And so I think there's amazing work happening in many places, but there's also an opportunity to think, how can we really be child inclusive? How can we build intergenerational relationships in ways that are safe and trustworthy? I keep using that term. And if we can do that, I think we will start to get some real shifts happening. But there are some positive examples that we can look to.
So using that research and experience that you have as a guide, Sharon, as well as your knowledge of Tasmania, what would you recommend as priority actions for community organisations who want to embed children's rights and participation in their practice and research?
I think there are a couple of things that I would suggest. One is using the language of children's rights, I think is really powerful, because that starts to move us away from thinking about how we can provide to children as kind of passive recipients, to how we can ensure that children have their rights met. We recognise that children have entitlements, but we also recognise children as active citizens, as active participants in our communities, and stakeholders in government decisions and in what community organisations do. So that language of rights, I think, is really important. I think we need to think really deeply about what we mean. We often use the language of child voice or child participation. And I think we need to think very deeply about how we do that in ways that are really meaningful. So if we talk about child voice, which often happens, how do we as adults then listen? And we often spend a lot of time thinking about the kinds of processes or mechanisms that we can have or that we can put in place to capture children's voices. But really, perhaps the most important part is what, as adults, do we then do with what we've heard, and how do we act? So I think, that responsibility that we have as adults, not just to talk about the importance of children's participation or their voices, but then act, is critically important. If we can start to, we do have quite age stratified hierarchical communities, not just in Tasmania, but everywhere. So how can we start to shift that so that we are genuinely building those relationships across generations, so that children know that they are supported, they know who the people are that are safe, they know who they can turn to when they're facing a crisis. But I would add one more point to that we do hear in our research that's really critically important. We hear this from children and from parents, and that is that poverty or the lack of being able to provide the basics because of systems and structural failures is often misunderstood as neglect. And we often hear from both children and parents about how frightened they are to ask for help because they're afraid of what the consequences might be. And one of the most terrifying consequences is that it will be seen as a child protection issue. And so as we're thinking about building communities and building community support, we need to make sure that we never make that mistake of thinking that poverty is actually neglect, because that prevents people from being able to ask for support, and it prevents support from being provided.
And those are experiences that are not, they're experienced by different communities in different ways.
Yes.
And that's why it's so important, I think, having the input of, organizations like SNAKE, who've been recently, providing, such amazing research and advice on how to, respond to disclosures of harm within a culturally appropriate and culturally safe framework of, what does that look like for Aboriginal families, and how might that actually be different for, populations that have really different interactions or experiences with those statutory systems. Children and families with disability would be another example, I would imagine, of families who would just have a completely different experience of that.
Yeah, I think that's a really good point, Megan. I think, if we look at some of the work that SNAKE's been doing, the influence that Catherine Little had on the National Early Years Strategy, we also see, while we need to recognise diversity, we also see how much we can learn when we genuinely respect and listen to Aboriginal and Torres Strait Islander people and communities about the place of children within their communities. There's a question in the chat. I don't know if anyone wants to have a go at that. I think it's a great question, so we could perhaps turn to that.
Yeah, I think what you were saying before, Sharon, about that kind of the long-term or longitudinal support kind of goes to that question. I might just read it out for those of you who might not be able to see it. So does any panel member want to speculate why we are stuck in patching rather than transformation? And if governments are letting us down on this, are there examples of how communities have got on and done it on their own? I mean, I think that what you were saying about Bernie Works is a really powerful example of people who are working in place and who know their community, and who I think that knowledge of community is such an important part of that. I mean, what about that part of why do you think we're stuck in patching, Sharon? What's the reason behind that, do you think?
I think it's a great question. So maybe that's why I sort of pointed to it. And I think we do have examples like the one I gave with Bernie Works, and there are many others of communities getting on and doing it. But I also think communities can't do this alone. At the end of the day, if we want transformational change, then some of that has to come from government, and it has to come from the way resources are allocated, and it has to come from the way policies are made. And a lot of what we see in our research, the pressure and that families are under, that is systems-led stress. So the role the government plays is really important, both in creating but also ameliorating that stress. The reason that we're stuck, I think this is a really important one, and I would speculate that some of this is around the politics and the nature of electoral cycles, and the fact that budgets one at a time, and possibly two or three within an electoral, 3 or 4 within an electoral period. And so I think one of the things that we actually need to do to move beyond the patching to the transformation is to very clearly articulate the need for transformation, and to give licence to governments to do that, to make it very clear that there are electoral gains and there is constituent support for transformation, because governments will often, for understandable reasons, develop budgets or to make policies in a fairly short-term way because of the nature of our electoral cycles. And so I think we do need to make it really clear and demand and give licence to government to act differently, and to push back on the continual patching rather than the identification of systems that are failing.
Victor, I can
yes,
see you've
Victor.
got your hand up. Did you want to say something? Or was that an accident? May have been an accident.
I was so excited. I thought we were going to have a wonderful insight from Victor. Victor, if you come back and want to... Oh, no, here we go. Now? Yes.
Yeah,
yes.
Sorry, well, I'll restate. Thanks, Sharon, for the paper. I'm from the Commission for Children and Young People. Just wanted your take, and this is related to the last question, about the value of reduction of child poverty or end child poverty legislation that I think is being considered in some jurisdictions, and there's going to be a sort of coordinated campaign later in the year from the Australian New Zealand Children's Commissioners, Guardians and Advocates body around raising possible legislation as a way forward. Just wanted to get your take on the value of those, and there are a couple of examples internationally on that front.
Thanks, Victor. I think the first thing that I would say is that the problem we face in Australia around legislation to end child poverty is that we don't have an agreed official definition of poverty for anyone, regardless of age, and we don't have an official agreed way of measuring that. And so that's perhaps the first conversation that we do need to have. And that sounds like a rather tedious conversation that may distract us from what really matters. And so it's not a conversation that we can afford to allow to go on for very long. But if we were to think about legislating to end child poverty, then those definitions really matter. And so we need to have those definitions in place first. If we look to New Zealand, we saw some pretty phenomenal things happen when the New Zealand government introduced a legislation around child poverty and an act to end child poverty. One of the tragic things, and this sounds like a word from your sponsor, but we're going to be talking with the New Zealand Children's Commissioner, Claire Ahmed, at one of our Children's Policy Centre webinars in later November. So I'll send that out to everyone. But one of the things that appears to have happened in New Zealand is that with a change of government, even with legislation in place, we saw a rollback of the commitment to actually ending child poverty, which is extraordinary. The government's rolled back a commitment to ending child poverty. And so legislation can be important, but it can also be rather tenuous if it doesn't have bipartisan support and isn't sort of well embedded. The other point that I would make is that while a piece of legislation may be important, there is also a lot that we can do with or without legislation if we genuinely have a bipartisan or a cross-partisan commitment to ending child poverty. And one of the things that we found ourselves in a position where, firstly, individuals are blamed for their poverty. There's been increasingly the idea that, well, it's individual responsibility. It's the responsibility of individual families. So that's a narrative that we have to shift. But there's also been a view that's developed over the past probably 15 or 20 years that really some people are going to be in poverty. There's not much we can do about it. Now, we know in the Australian case that that's not so, because if we go back to 1987 and Bob Hawke's famous election call of, comment in an election campaign that no child need end in poverty by 1990. Now, we often look at that and as a joke today, but if we actually look at what happened in the wake of the Hawke government's commitment, we saw a decrease in child poverty from about 18% to about 14% over a period of about 6 or 7 years. Now, that's not a dramatic decline, but it's not bad. And that was through a range of policy initiatives that were focused on providing better income support to families. We then saw with the advent of the Howard government, a shift away from those policies and much more focus on harsher conditionality, on lower levels of policy. And so we saw what happens when policy shifts away from a commitment to reducing child poverty. And successive governments of both persuasions across states and territories and federally have kind of maintained a kind of very individualised view of poverty ever since. So on an act to reduce child poverty, I'm a little bit ambivalent, just because without deep political commitment from all sides of politics, we can see it slide away. But building that deep commitment, absolutely, that's critical, because we know that child poverty can be reduced and probably ultimately ended in a country as wealthy as Australia if we have genuine commitment to do so.
Sharon, thank you so much. I've got the unfortunate task of letting everyone know that this is over. I feel like I could keep talking for a really long time. Thank you so much, everyone, for your thoughtful questions and feedback. And I know that an hour is not very much time. So if you have things that you would like to discuss with Jill and I, questions that have kind of come up as a result of the things that we've brought up today, I'm sure Sharon might even be open to answering a few questions. If you wanted to send them through to us, that would be really, really fantastic. So just once again, a huge thank you to Sharon for your research, your time, your passion, your care. Thank you so much, everyone who's attended. And a copy of this recording will be available on our website. And just a gentle reminder that if you've enjoyed this policy conversation, you may also enjoy the policy conversation we're holding tomorrow, also on the budget. So details about that conversation can be found on our website. But a huge thanks to Sharon. And we'll also, I'm pretty sure we've included in the materials a link to the policy, the Sharon's policy work, the Children's Policy Centre. But please, we would encourage you all to read the fantastic research that she's been doing with Bernie Works and just her research more generally. So thank you.
Thanks, Meg. Thanks, Jill. Thanks, everyone. Thanks, Jill. See you later.